Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning. How are
Good
you?
morning.
Good morning. How are you?
Wonderful. And you, Dr. Mencia?
I'm doing great. We're going to have Anita on the phone talking to us. Anita, good morning.
Good morning, Dr. Mencia. It's so nice to speak to you.
I can't wait to see you and give you a big hug, Anita. I miss you so much.
I know. You know, it's interesting that we've talked about so many subjects and always talk about other people, but here it is. I'm here with my wonderful husband who's trying to rehabilitate from having, the surgery, and then it's all the extra things that come along with surgery that you don't expect.
That is correct, Anita. When people move into high level, certain age level, in their 80s and 90s, they say geriatrics at that age become like pediatrics. So it takes a lot of patience. It takes a lot of good clinical judgment from the people taking care of Bill to get him going, and then come the rehabilitation after all the surgery and all the things that he's been through. How is he doing?
Well, I wish I could really give you a straight answer. It goes from one thing to the next. Now he's at Regents Park, which is a wonderful rehabilitation center, as you know.
Absolutely.
But he is being fed with a peg. In other words, he failed the swallow test. And that's something we've never discussed on our show, that we just assume everyone swallows. But after surgery and someone is older, they test the swallow, and if it isn't perfect, they're afraid that the fluid's going to go down the lung. So they prevent them from doing that, even though he had started with ice and he started with puddings. But then they said, well, there was a little something in his lung. They cut that off. Then he didn't have enough nutrition, and then they decided to put a peg in, and now they feed him in a peg.
Okay, let me educate the audience so that they can follow along with us. A peg is a feeding tube that what we do is we do an endoscopy like we do when we want to look for ulcer in the stomach and all, those sort of things. We put an endoscopy, and then we look at the light through the outside by the stomach where the light is shining, and then through there we put a needle and we make a hole that will communicate the outside with the stomach. And then through that hole, just like you put a Foley catheter to get the urine out of the bladder, we put a catheter in there that will, through which we can give the nutritions and the pills to the patient so that they can have all their nutrients in a natural way. So what that means is that when you have a feeding tube, you don't have to be getting nutrition through the vein. And the best form of nutrition is the one that you can get through the tracts, to the gastrointestinal tract. So that is the advantage of having a peg during situations like those. So go ahead, Anita. So he has a peg.
No, thank you. Thank you. I'm glad you explained that. So I'm sitting here with Bill, and the most important thing, and we have talked about this, is being an advocate, making sure that you are, or someone is there all the time to watch over what all the nurses, all the therapists are doing, because, they just don't have you as the only patient. They have sometimes 10 people, and they're all very good people. They're very dedicated, but the person whom you love needs to know you're there.
Absolutely. And the recuperation, the speed of recuperation is determined by the loved one. It's not only by the staff that is attending to you. Like you well said, they have many other souls there that they care for. But when you have a loved one there, that's what's going to motivate you to, get stronger and sit and do your therapy. You feel at home when you have a loved one next to you, somebody that cares is next to you.
Yes, because they know, because they brought a bed into the room where I am so I could sleep, but
Oh,
sometimes
how romantic.
Yeah, right. I wanted to crawl into bed with Bill, but there's just not enough room. Oh, hear him? Yeah, he's. It's funny. He hears everything I'm saying, but his speech is not exact. He talks a lot, but I'm having a little hard time understanding everything. Mm-hmm. And also, I think the problem is that they sleep maybe in the morning, and then when the rehab comes in, he's not awake. And then the speech people come in, and of course we've just started this all. They need to get him up so that he could sit up and then get into a wheelchair so that we even know what's going on. Right now there's just, everyone's working on it. They have a doctor here, but there's a lot of, we're not sure of anything, and that's a little frustrating, but what everyone's told me and I'm doing is patience, 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 right?
Absolutely. Perseverance. You have to keep pushing.
Yeah, and so anyway, let's just talk about you for a minute. So it's a happy time, I hope, for everyone, your staff. You've had a lovely Christmas party, and now will you be going to the office today?
Absolutely. Yes, I will. Yes, we are open today, half a day, like every Saturday. We will be closed on Monday because of the holiday. So
right.
We want to wish all our listeners happy Hanukkah that start tonight, and a Merry Christmas and a Happy New Year to all our listeners, all of those faithful listeners that have followed you and I for years now.
And you can give your phone number because I don't have that in front of me. I'm sorry.
Yes. If you need to call the office, we will be open, like we just said, throughout the holidays. So the phone number is 954-489-1345. And I have my sidekick here, my executive office manager. Maybe she can give the address.
Oh, my God. I didn't know.
Dobre utro, Ina.
Доброе утро. Hi, Anita.
Oh, good morning, sweetheart. Oh, you're such a wonderful, I don't know. You're like the angel that is always there, and you've done so much for the whole practice. But I thought it'd be a good time to talk about that wonderful medical spa. I can't wait to take some of the treatment.
And the salt bed massage, the salt bed treatment is like wonderful. I have some of my patients I have recommended, and they have come back to me, and they say, "Oh my God, Dr. Mencia, my sinuses are so clear, my skin is so soft." And as a matter of fact, I have one patient that came to me and say, "My sinuses clear so much that my daughter that suffers from asthma and sinus problem, I brought her in, and she cleared up so much. I couldn't believe that." I say, it's like going to the Dead Sea, except you don't have to get in the water and get wet.
And to travel.
And you don't have to travel. You can save all the money.
Okay, well, that's a wonderful thing, and that's one of the first things that I want to do when I get a break from this. So, have you done it yet? Have you done it, either one of you?
Not yet.
We're too busy. I'm so busy at the office.
I'm dying to go and try it, but it's so many things. It's been crazy. It's a holiday season. It's too many things to do.
And we don't close the office. I think this is the time that a lot of my patients, they need me. So I want to be there for them. So
yes, I know you do.
Yeah.
So let's talk a little. I'll tell you something that was interesting. The one thing they wanted to know before they came into the Regent's Park was, has he had pneumonia and flu shot? Absolutely.
Exactly.
So that's why it's so important. We talked about this, and do you still have patients coming in, Dr. Mencia, that don't have their shot?
Absolutely, and we keep telling yes, and but it's mandatory. Once you get into a rehabilitation center, they will ask you in the hospital, and then they will ask you in the rehabilitation center. And if you have had it, they will give it to you there. But the problem with those patients is that you lose track of when you had it, because when you do it with your doctor, it's in your record. It will always be there. When you do it at the pharmacy, or you do it at your workplace, or you do it someplace else, you're gonna lose track down the road when and where you have this done. And just for safety's sake, have it done at your doctor's office, so that at least you're going to have a record of every time you have done your shots.
And are you finding a lot of people, is the flu season really being a problem for you?
It's a horrible problem. People are coming in sick, and people need to understand, especially, and I have a good case that I want to talk about. There was a case of a patient that came in as a new patient. And, of course, he had refused to get the pneumonia shot. He's a smoker, uncontrolled high blood pressure. And he said, I have this cough, but I know my cough is from my smoking. I always have that smoker cough. And I said, so you wake up in the morning coughing? He said, well, now I'm waking up at night with a cough. I said, interesting. Any other symptom? He said, well, I feel lightheaded, and that's something new for me. And when I go to bed, I notice that both of my ankles are somewhat swollen. And I don't have the same stigma. Now, this is a administrator of a hospital. See, I don't have the same stigma that I have when I'm walking around the hospital. And I say, and I praise God so many times that I'm able to do the blood test in my office. I'm able to do the echocardiogram in the office. So I look at the swollen ankle, listen to his heart that was kind of distant. So when I do my physical examination, everything was pointing not at the fact that he's a chronic smoker like he thought, but he was going into congestive heart failure.
Oh, my.
So he had heart failure, and heart failure, for the listeners, is when the heart, the heart is a pump. And when the heart is not pumping to its maximum capacity, as you know, when you are resting, when you go into meditation, the heart will decrease the amount of blood that gets pumped with each beat. But when you are running or going upstairs, then the heart starts pumping at a higher volume so that you can meet the demands of the oxygen for your muscle and your brain and your lung, etc. So this guy couldn't even walk in the hallway without feeling shortness of breath. And when he decided to switch doctor and come to see me, is when he was talking to his brother, and he developed shortness of breath on the phone. He couldn't pull out a full sentence without stopping and gasping for air. And the brother said, the brother listened to us, so he's listening to this program. I said, I'm always listening to Dr. Mencia in South Florida. What the heck you doing? Go and see the doctor. So he came in as a walking patient out of everything. So we were able to make a diagnosis on the spot and put him on treatment. And then we put a visiting nurse to come in, and I said, since he's taking time off from the hospital as an administrator, let me get the visiting nurse so they can text me and let me know of your progress. And he's so happy that we open 6 days a week. He never heard of too many doctors around that would do that. So being an administrator, he said, I'm going to let everybody know, all the nurses, I'm going to let them know what you are doing. This is the right type of care that we should be providing there in the community.
And Dr. Mencia, you did that once for Bill. I remember the same thing. The visiting nurse came and he never got pneumonia or anything, but you watched him.
Exactly. And I told him, during the holiday, the last thing I want my patient to end up being admitted in the hospital. Now, I cannot leave you without doing something that I think is very important, Anita, that we do for our audience. Now, let's talk about you, the caregiver. Tell me what you are going through, honey. Let's educate the people about you.
Okay. It's really interesting. So, you know me so well. I am a ball of energy. I've always had a lot of energy, and people say, oh, you have to take care of yourself. Well, I have to tell you something. If I were to be home or I were to be not here, I would fall apart. But I have a lot of energy, and I need to be here with Bill to observe. And so I slept at the hospital most of the time. I have Bill's driver would come and bring me things, but I have a lot of energy, and I feel very good, and I need to be here. That's who I am. Maybe not everybody's like that, but that's how I am. So taking care of myself, I have friends that come over, my family has come over, but maybe I take an hour to run and do something. I got to tell you, this is really so important to me. My dedication is for Bill. And
Well,
I'll tell you something else that you're going to love. Wait, I know what you want to tell me.
Go ahead.
I realize that I have spent too much time in business, and he's been so patient. And I usually leave in the morning. I'm not there for lunch, and he takes care of himself, or he used to. And then I run in. Sometimes I don't get home till 7 for dinner. That's all going to change now. When we get him home, I'm a different person. I am going to make him the most important thing. So if I leave early in the morning, I'm going to be home to just have a little lunch. Then I'm going to make sure I'm home, for dinner and to be with him a lot more. It opened my eyes, and I'm hoping people are listening to this. Don't take anyone for
granted.
And I know you want me to take care of myself, and I am. In fact, one day, what I do is I lie down on the floor and then make my legs go up and try to do exercises. I had someone run and say, "Are you okay?" Yes, I'm exercising. Even here at Regents Park, where they're so good to me, usually I've been sleeping on a chair or in the hospital, they brought in a lounge. People have been very nice. Well, here they brought me a lovely little extra bed. It's a private room. And I sleep, but then I can hear him. If he calls me, I am up. Because this is what's so important to me. I don't really care about anything else. I'm doing fine. I don't feel my back's okay. They bring me a nice breakfast, lunch, dinner. So now what do you want to tell me?
Well, I want to tell you that it's all about the type of personality that we all have. And you have the type of person that you tell them, you have diabetes or you have high blood pressure, you have this, or something related to your loved one. And you have the type of individual that will stick their head in the sand and say, "I'm not looking that way, it's going to disappear." But that's not you. You are the go-and-getter. You are the one that will fight, and those are the type of caregivers that will avoid becoming depressed because you are active doing something for your loved one. And I think that's a big plus when any of us are facing this situation, is that we get involved the way you are doing it, and is therapeutic to the person that we care for, but it's also very therapeutic to the caregiver. Do you agree?
So you said that I knew. I know you've been so busy, and we haven't really gotten to talk on one level, but that's very good advice. You're right. I have not been depressed. I mean, I've been awakened to what happens in hospitals, I'll tell you that much, and I've been awakened to actually be in a rehabilitation center, not just talking about them.
Right.
And I think what I wanted to do, once I get myself straightened out, is start a column in Boomer Times on just generic ways that people can think about medical facilities, what they can do to help themselves, other people. There's a real benefit to this for me. I want to make this into a positive situation, and listen, we're doing everything we can for Bill. We hope, and we're going to get him the best therapy. We're going to do everything. But, I love him very much. He's 93 years old, and he was in very good condition. But, I know it's going to take time, and we're going to get him to do a lot of things. And I don't want to think about anything else because this is how I think. And I know you think like this, too.
Absolutely. But, knowing you, Anita, over so many years, I am sure that you are studying your surrounding. So tell me about those patients there that do not have an Anita Finley to care for them. Tell me about those patients, honey.
Well, this is one of the things I want to say to people. And I know you've been an advocate for your father-in-law and for your mother-in-law. You understand that, and I know that. And I hope that everybody finds an advocate before they get sick. It is very sad when I see people alone, and I've seen a lot of them alone. They go down for, whether it's a CAT scan, or they go, for things, and they're in their bed. And even though nurses are nice, they need someone that could be a friend, can be someone, but people need to have someone there with them most of the time to hold their hand, to be supportive. So I'm going to urge people. It's very important that we discuss this. You should find an advocate now, before you're sick. Find girlfriends, find boyfriends, someone who's going to come and people who are going to come and be there for you. They don't have to, be there all the time, but people wait, and then it's too late.
Absolutely. And a lot of people have the misconception that an advocate had to be a brother or a sister or a mother or a father or a son or a daughter. It does not have to be that. The question is, who will be the person that I know that will be at my side when I need a person? That's your advocate. It could be a coworker, it could be a friend, it could be somebody that, number one, is going to be at your side. Number two, is that person the person that is going to protect my goods, my money, my apartment, the same way I will protect it? Because, a lot of people that bring an advocate and they do it at the last minute out of a desperate need. Sometimes they get robbed, in daylight, and they lose everything. I just had a patient like that, and the patient was telling me, they went into my apartment because I was in my dying bed, and they cleaned my apartment. They cleaned everything up, the jewelry, everything was gone. And so when by the way he did it out of desperation, not because what you are saying now. You have to do it now that you are well.
Yes. The interesting thing that we talked about this, because I have some spectacular lady professionals there. Some of them, and I said now to them, what would happen if you had a problem? Who has a phone number? A very close friend, and her brother, one person now, her brother lives in Bermuda. And I said, we're very close. You've never given me his phone number. What would happen? I mean, I would come and help you, but I don't even know how to help you. I don't have your key to your house. So she's starting to think about it. I have about 2 or 3 other people. They have nobody. That's terrible.
That's horrible. That is horrible.
Maybe when you have an intake, when you have new patients, maybe that's something you should be adding to your, to your list. Sure, you want to know the nearest of kin and all that, but maybe it's talk to them for a minute and just ask them, if something were to happen, do you have an advocate who would be there for you, or some people who would watch over for you? And I mean, I just can't believe it. I mean, you're very lucky because you have Dr. Mencia and you have a world, but other than that, you're pretty much alone here. You have your ex-husband, you have your son, but
that's exactly, Anita, what I was just thinking right now. When you and Dr. Mencia talk about it, I was like, oh my God. I don't really have anyone. Like my work is my family. That's all pretty much I have.
I know, but see, you're lucky because everyone loves you and you will have lots of support. But what if you weren't there and you were working as a secretary somewhere, or as a bookkeeper, or even as a doctor somewhere, and you didn't have anyone? Because your mother's in Russia. What would you do?
Exactly. And who will call your mother? And, if you don't show up to work for 3 days, who will be able to get into your apartment and check on you? It's so many things that
That's why, Anita, I'm going to stay where I am forever.
Yes, I know. And you do help so many people, Ina. When I want to get to Dr. Mencia, the first person I call is Ina, because she's always there. She's such a magnificent woman. She cares about everybody. She did all the Christmas decorations. She does all the things. But
Anita, yesterday I was giving the bonuses to my staff, and I was telling them, as a joke, but it's the fact, it's the truth. I say everybody's getting bonuses here except me. So they all laugh, and I say, there are some people that work there, like Patricia, that work at checkout. And
I love her.
And Ina, that has started from the front desk to the checkout section to the scheduling, and she kept moving from, like, jumping like a jumping bean, going from one section to the other one to become a executive manager to both of my offices. And she's a go-and-getter. Now that I opened the spa, she got involved with that. She's helping with everything she can. I'm so grateful to people like her. But at the same time, she had to.
Yes. Dr. Mencia, that's the most important thing, to look into people. And you can't look with it. Look, she's beautiful, but there are a lot of people who don't have physically beautiful, but they have a kind heart. And that's what I know you always look into people with that.
Her headphone doesn't fit on her head anymore.
Anita, my head is so big right now.
It could be. When we first came here from Russia, you would never speak on the radio because no one would understand you.
She was so shy.
Yeah.
All these foreigners, and now can't stop talking.
Yeah.
I have the United Nations in my office.
That's it.
The one thing I will talk about Haitians, because we have seen a lot of Haitian people supporting in all these places, and I just hope that there's never prejudice against Haitians, because they are without a doubt the sweetest, the kindest people, and they're working hard. And so one thing people should remember, when you get someone who's a caregiver, don't look at the color of their skin, don't look at where they come from, look at their heart, and then you'll get the best from them.
Absolutely.
They also have a need. They want to do good. That's what I think in the world, like Dr. Mencia. I know him so well, and his whole, I'll use the word modus operandi is to help people, to do good. I mean, he spends 6 days a week and even more helping people. You have to find someone like that. I will say this. I've seen some doctors throughout this thing with Bill who come in. I'm sure they're very, very good, but it's hello, goodbye, done.
Yes, absolutely.
I got to tell you.
Anita, this had been one of the most wonderful half hour in our history of doing the show together. I love you so much. I can't wait to hug you for half an hour and won't let go.
I'm here at Regents Park, so you come by when you get a chance.
Absolutely. give Bill a hug from me and a kiss, and let him know how much I care and love him.
Yeah.
And we'll see you next Saturday.
Yeah.
And we will continue to support you. You do what you have to do for Bill. You do your stuff there. And,
I thought I would, for the article, I love the conversation that, I know we have a next show coming, but I just want to tell you that the conversation with the gynecologist was extraordinary, and I'd like to write that for the article. Yes. Okay.
And, you have a hidden treasure here called Richard. I mean, Richard had, had kept his, the work done here. He's a wonderful man. Yeah. I'm so happy.
Yes, he is.
That he's part of our team over here.
Yes.
Anita, have a great weekend, and we'll be talking.
All right, thank you.
God bless you.
So
Happy Hanukkah.
I love all of you. Yeah, thank you.
Bye-bye.
Bye, Anita.
Bye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.